of the clinical fellows at Frimley Park Hospital in Surrey, and it is my pleasure to tell you today about a study we've done about the short-term continence outcomes in men over the age of 75 undergoing robot-assisted radical prostatectomy. So if we look at this slide, we can see that unfortunately the rates of prostate cancer are still on the rise, and there's been almost a double increase in the last 20 years. And the main age group that is currently being diagnosed is patients in between the age of 70 and 79. So the reason why we decided to do that study is because a radical prostatectomy is one of the main treatment options together with radiotherapy, but they have completely different complication profile, with continence and impotency being the main side effects of radical prostatectomy. However, it does offer reduced hospital stay, earlier recovery, and reduced bleeding risk. But despite all of these benefits, this age group of patients are rarely being offered this procedure, and multiple studies showed the majority of them still are being treated with radiotherapy. So this study in itself is a retrospective analysis of a database that is being maintained prospectively. And the study was done in a tertiary referral center in the UK. And we've analyzed all the patients, which was just over 600 patients that were treated with radical robot-assisted prostatectomy in this center in between 2018 and 2021. On average, all of the patients were, no matter of age, were offered this procedure if their ASA grade was between 1 and 3. The reason why we didn't offer to patients with higher grades is because of reduced life expectancy. And in total, we identified 36 men that qualified for the study. They all had the statin procedure with an 18 French silicone Foley catheter placed and removed 5 to 7 days after the procedure. To assess the outcomes, we used the continence assessment questionnaire that is validated, and we also used the number of pads they use per day, with 0 pads being considered as fully continent. We did not investigate potency rates because most of the patients had already erectile dysfunctions at the time of the procedure. Here you can see some information about patient demographics and characteristics, as well as surgical and pathological details, but I'm not going to spend time on it now. If we go to the results, we can see that at 1 year, 63.9% of patients were pad-free, 19.4% were using 1 pad just for safety. And if we combine these two groups, because the outcomes both are pretty good, 83.3% of patients were continent. Yes, we can see that initially the rates of continence were not that great. However, they improved gradually over the first year, which could be potentially explained with the number of patients that had bilateral nerve sparing done. Here you can see a slide with some of the overviews of very few papers that are available on a similar topic, because there's not much literature available that investigates the continence outcomes in elderly group. So I've just put a slide of comparison between the study cohorts. But if we look at some of the very few studies available and the outcomes at 1 year, we can see that on average the results are quite different, with some studies giving almost 100% outcome and some giving just over 40%. But our study is just in the middle of this. And on average, yes, the younger group has slightly better outcomes, but I still think that the continence outcomes in this age group, in the over the 75 years age group, is pretty good. Yes, this study has some limitations, such as relatively small sample size, the fact that it's a single center study, and it's a retrospective design. The most important is that the outcomes in terms of continence is a subjective assessment, but unfortunately, that's the only way how we could think of evaluating this outcome in a clinical setting. And we did not have a control group of younger patients to compare it to. In conclusion, the patient's age should not be the only guiding factor in making this decision. Patients should be evaluated with proper geriatric assessment, and if they qualify, if they're fit enough and they would like to go ahead with this procedure, they should be offered this option. And the continence outcomes is a gradual improvement, and it's slow, but by the time of end of first year, the outcomes are pretty good. And there is a really big need for larger long-term studies, as currently the information and literature is very sparse on this topic. Thank you for your attention.